I'm Dr. Leo Powers, and I'm going to talk about autism and category 1, 2, and 3. And we're at Powers Chiropractic in Plover, Wisconsin. And they divide the stress in Sacro Occipital Technique into category 1, 2, and 3. And I was friends of the family of a case study, not of autism, but they had learning problems. And so they were in first grade, and then they were in remedial math and reading. So I learned the category 1, and then they were treated for that. And that has to do with stress in the body. It's a respiratory fault, and then you tend to shift front to back like this if you have category 1 stress. And so that was treated, and I didn't really notice any difference, and I didn't hear any report that he was any better reading or doing math. And so the next session we went to, I went about once a month, and so it was category 2. So this treatment has to do with blood sugar because it helps your liver, pancreas, and adrenals to work better. And if you have category 2 stress, instead of front to back like category 1 is side to side, that's category 2. And so we did the pelvic adjustment and then the head adjustment. And the head adjustments is kind of a 7-step process, when you do that. And so that was done for this young man when he was 6, and he got, the dad reported to me that there was going to move wood in the basement, and normally he'll move one piece of wood and then go up and play Legos. So he likes Legos, but he doesn't like, he wasn't really good at focusing and learning. So after that category 2 cranial went down, and to move the wood, and he moved all the wood with him. I mean, so that was a big change, moving one piece to moving all the wood. So then he got his quarter or 50 cents, whatever it was. So he was happy. Save his money for Legos. So that was category 2, the first category 2 cranial. And then the next month went back and got category 3. And the category 3 has to do with no motion in the head or the pelvis. And so I learned how to do that, and then I did treat him. And then after I treated him for the category 3, then I treated him for the category 2 again. And this time, when he got the category 2 cranial, which is a 7-step process, he started to read, just really easy. And he had a book from the church that was Intro to the Bible stories. He read the whole book in about a day. And I could hardly believe it. And he was happy, and he got to read, and and so I was like, this is fantastic. Now, one thing about this case, this family followed, there's a Price Pottinger Foundation, and Dr. Price was a dentist that followed primitive people versus a modern diet. And this family followed a primitive diet, so they eat vegetables, fruits, nuts, seeds, brown rice, beans, meat, which is healthy. And instead of drinking pasteurized milk, they got raw milk from the neighbor down the road. The neighbor gave it to them, and so they got raw milk, and so that's got omega-3 in it. But they'd already been doing that for several years. So anyway, so that helps with brain function also. So anyway, so that was the difference. And in the autism I looked it up, and the rates of autism are high in United States, and it's getting worse and worse, and also in Britain, Japan, but not in France. And over in France, they use raw milk, and they eat vegetables here too, but they use raw milk over there. So that may be the difference between autism here and over there, and that may be a significant factor due to the omega-3 oil. Now, you can get omega-3 oil in other sources. There's fish oil you can get, but there's different reasons why it's higher in that. So this was a case of learning issues, and autism, they have trouble learning, and this was a case where they weren't autistic, but they had problems learning, and then they learned just fine, and the rest of life they were perfect. Well, not perfect, but I mean, they were just fine. So to understand how autism is different, I'm going to take this down and then show you A lot of times autistic people, they have trouble hearing, and they have trouble, well, they don't have trouble hearing, but they have trouble understanding what people say. So they have trouble learning. And so this is a picture of the buttock area, and then you got your gluteal muscles. And I learned how to adjust the muscles connected to the hand and the foot, and it'll be on a different session that'll explain it in more detail. But basically, when that's not functional, and you can tell on the butt muscles, they'll be tight if they're not moving fully. And so when you breathe in, the sacral apex comes forward here, and this is the head, and this is the pelvis, and this is the front, and this is the back. And so when you breathe out, this comes back. But really what happens is the iliums flare back in. You know, they flare in like that when you breathe out, and the sacrum moves forward, and then that flares in, and then that moves it back. So if the buttock muscles are really tight, and this is, with a lot of thought, this is a theory why this is there. But so when you breathe out, these muscles have to move in, and then if these are tight down there, then it's hard for this to move up in here. And so, so that's what I think it is, you know, related to that. But I've gone to seminars, and they talked about autism, and some of them had good relief with working with that category 1 and category 2, you know, to get them so they could start to talk again. And if they are talking, and if you want them to help them to hear more of the information, and if they have tightness in here, and I'd be happy to check them if you want to just bring them in sometime, and we'll get them in between patients, and you can just schedule a quick exam just to check them. But a lot of times it's really tight through here, and when it's tight there, then you don't have that full motion, and then it'll impact their ability to learn. So basically, that's how that works, and I thought I could help lots of people with learning issues. But the problem is, a lot of people, they drink a lot of you know, soda pops, and they eat a lot of candy, and then they have problems learning. And you know, some people can do that and they don't have problems learning. But usually people that can eat more nutritious food, usually they learn a little bit better in general. But there's each person's an individual. So I did talk about diet a little bit. I wasn't going to talk about it, but I did. So anyway, so we're here in Plover, Wisconsin, Powers Chiropractic. And I have worked with several other patients that have had learning issues, and that helps them learn better.